Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be going over alcohol-related disorders. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it, so go ahead and give it a thumbs up now. Subscribe to my channel if you haven't done so already, and don't forget, I'm now offering next generation NCLEX reviews. You can reserve your spot by going to my website, nexusnursinginstitute.com. If you are a current nursing student, you're not studying for NCLEX, you're just trying to get through the program, you have to do very well on your next exam. Be sure to check out the audio lessons I have on my website, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms. My handle is the same everywhere, Nexus Nursing. You can find me on TikTok, Instagram, and Facebook. Without any further ado, guys, let's get started. Alcohol-related disorders. Select all that applies. Your patient is diagnosed with dementia and alcohol dependence. Which point should be taught to the family? If quitting is not a personal goal, be prepared for attempts to procure it, which is alcohol. With removal of alcohol, the dementia should improve. To strengthen the patient's memory, avoid repeating anything more than once. Place safety alarms on all doors to keep the patient from wandering off. As the patient's condition worsens, he may need to be placed in a long-term assisted living facility. The patient is permitted a glass of red wine for dinner every evening. All right. This is a patient that's been diagnosed with both dementia and alcohol dependence. What would you be teaching the family? All right. The first one, this is true. If quitting is not a personal goal of the patient, the family needs to be prepared for that patient trying to get alcohol one way or another. That's true. The next one is false. With removal of alcohol, the dementia should improve. Let me tell you guys something about dementia. Dementia is not delirium, okay? When we're talking about delirium, delirium can be reversed, right? Once you find the underlying cause, it could be reversed. But guess what? Dementia? There is no reversal. As a matter of fact, dementia is what's known as progressive. That means as time goes on, it only gets worse. So there is no improvement with dementia. As time goes on, it's going to get worse. So that's false. Next, to strengthen the patient's memory, avoid repeating anything more than once. That's also false. Why? Because the patient's got dementia. Their memory is only going to get worse, so that nothing is going to improve that patient's memory. Again, it's progressive, so that's false. Next, place safety alarms on all doors to keep the patient from wandering off. True. If you've ever been to a dementia unit, you'll see that there are safety alarms, there are locks. Why? Because as this disease progresses, safety becomes even more of a factor, and we don't want the patient wandering off. We don't want them getting harmed. Next, as the patient's condition worsens, he may need to be placed in a long-term skilled living facility, assisted living facility. Absolutely, because again, this is a progressive disease, and the patient's going to get to a point where they are going to need total care. All right. They will see a toilet and not even recognize that a toilet is a toilet. They won't even know what the toilet is for. They can get to that point. And last, the patient is permitted a glass of red wine for dinner every evening. 4 of you chose true. How? Let me tell you something. In nursing, we don't ever encourage alcohol or smoking. I'll tell you that right now, right? That's number 1. Number 2, the patient has been diagnosed with alcohol dependence and dementia. When would you ever encourage a patient that's been diagnosed with alcohol dependence to be able to have alcohol under any circumstances? They're dependent on the alcohol. We don't want that. So no, we're not going to encourage, even if it's just a glass of wine. Wine is still alcohol. We're not going to encourage that. Okay, guys? All right, moving on. Your patient's withdrawing from alcohol and they're complaining of insomnia. Which nursing intervention would be most appropriate? Would you invite the patient to play a board game with you? Would you invite the patient to sit in the common area until they start to feel sleepy? Would you encourage the patient to take short naps during the day until the symptoms improve? Or would you teach the patient relaxation techniques? What are you going to do? Very good. Most of you guys chose to teach relaxation techniques because patients experiencing insomnia, right? And if you go back to the question, they tell you that the patient's withdrawing from alcohol. The fact that we know the patient's withdrawing from alcohol, we should already suspect the patient may be suffering from insomnia. I want to explain to you guys what's going on. All right, first of all, alcohol withdrawal is extremely deadly. And let me explain to you why. A lot of people don't realize this. They think that alcohol is a stimulant because you watch the movies and people get drunk and they're partying and they're doing all of this. But no, actually, alcohol is a depressant. It is a CNS depressant. And so what happens is when a patient's an alcoholic and they're dependent on alcohol, from them drinking so much alcohol, those neurotransmitters, the CNS starts being used to being depressed. So the minute that patient starts to go through alcohol withdrawal, it's like a light just flip, and then all of a sudden the patient's experiencing the opposite, but much, much worse. They're experiencing, instead of CNS depression, they're experiencing CNS stimulation, hyperstimulation. So that's why the patient can't sleep. They have insomnia. You're going to see everything up, blood pressure up, heart rate up, patients at risk for seizures, right? We're going to see hyperstimulation. This is very lethal. So it makes sense the patient's going to have insomnia. So you're going to try to teach them relaxation techniques because at this point, everything is up and we're trying to bring it more down. Now, look at the wrong answer choices. Invite the patient to play a board game with you. All right. So this patient has insomnia. They can't sleep. We're dealing with CNS hyperstimulation, and you want to make it worse by stimulating their brain even more, playing a game? No, they need to go to sleep. When you're trying to get a patient to go to sleep, you want to create an environment for sleep. You want to dim the lights. You want to turn off the television. You want to turn off the radio. You want to have the patient at the end of the hall where there are too many people talking, too many family members down the hall. They're not near the nurse's station where, other nurses are giving report or the nurses are answering phones. No, you're trying to decrease stimulation. So we're not going to do that. Next, invite the patient to sit in the common area until they feel sleepy. You want to know what a common area is? The common area is where everybody hangs out. That's where all the stimulation is going to be. No, we're not going to do that. We're trying to decrease stimulation. Next, encourage the patient to take short naps. I wish I had my sign right here. Why would you have them take short naps during the day? If they take short naps during the day, do you think they're going to want to be sleepy at night? No, that doesn't make any sense. Duh. So you're going to teach them relaxation techniques. You're going to teach them deep breathing exercises. You're going to decrease stimulation in the environment. Are you guys with me on the live? All right, let's keep going. All right, this one's a puzzle. You receive a call from a woman complaining of her husband's behavior. He's acting erratically. He's yelling. She reports that his drinking has worsened. Prioritize your nursing interventions. What are you going to do? Take your mouse, guys, and put it in order. This is how it works. How come I only see 3 choices? Well, the 3 choices I'm looking at, it says, what have you done in the past? What have you done in the past in response to his behavior? Next is say, this must be frustrating for you. And next you say, we often see this type of behavior in alcohol-related disorders. So put your responses in order. There should be a 4th response, but I don't see it. Take your mouse and put those responses in order. How would you respond? Okay, 20 of you guys got this right. So the first thing you're going to do is acknowledge the statement. You acknowledge them. This must be frustrating for you. You say that, and then you're quiet and you allow them to respond. Yes, this is very hurtful, blah, blah, blah. You want them to express their feelings. After that, you say, we often see this type of behavior in alcohol-related disorders. This is going to be comforting to them that they know they're not the only one, and you're letting them know that you can help. Then last, you ask this question. What have you done in the past in response to his behavior? You want to know what they've tried in the past that obviously hasn't worked, right? And the last thing you say, which it was a choice, I don't know what happened here, but I'm going to tell you, you ask them when they can have the patient come in, or what are their plans for having the patient come in to be evaluated. Think about it. You acknowledge the statement. You help them feel secure in their statement. You ask them what they've done in the past so you can get an idea of what they've actually tried that didn't work. And then last, you ask them to have that patient come in so that patient can be evaluated, okay? Select all that applies. What are the expected clinical manifestations of a patient diagnosed with alcohol withdrawal delirium? Select all that apply. Here are your choices. Tachycardia, tachypnea, hypertension, red flesh, dry skin, excessive thirst, polydipsia. What are the expected signs and symptoms or clinical manifestations of a patient diagnosed with alcohol withdrawal delirium? The PIN is 883-3296. 883-3296. Okay, very good. So remember I said when the patient is going through alcohol withdrawal, we'll see hyperstimulation of the CNS. Everything goes up. Tachycardia, heart rate goes up. Tachypnea, respirations go up. Hypertension, blood pressure goes up, right? So those are true. Now, what's false is red flush skin. We see red flush skin in what? A patient experiencing diabetic ketoacidosis. Next, excessive thirst. We see that in what? A patient experiencing diabetic ketoacidosis. And last, polydipsia. We see that in a patient experiencing diabetic ketoacidosis. So the first three are correct. Those are signs and symptoms we expect to see in a patient experiencing alcohol withdrawal delirium. Your intoxicated patient is admitted for alcohol withdrawal. How do you help your patient become sober? What do you do? Do you give the patient black coffee to drink? Do you ambulate the patient for 15 minutes? Do you have the unlicensed assistive personnel assist the patient in taking a cold shower? Or do you help the patient get comfortable to sleep it off? What would be your nursing intervention in this type of situation? I'm so proud of you. Sleep it off. Sleep it off. Guys, it takes a while for alcohol to be oxidized in the body. And there's nothing you can do to speed it up. There's not enough black coffee in the world, cold shower, and you don't want to ambulate. It's a safety issue. We don't want them stumbling. We don't want them falling and hurting themselves. So we're not going to have them walk, right? It's a safety issue. The best thing to do is make sure that the patient is safe and comfortable and sleep it off. Select all that applies. Your patient's admitted for alcohol detoxification. Detoxification or detox? You know what I mean, detox. Anyway, which nursing intervention should you perform? Select all that apply. Here's your choices. Take vital signs, monitor INOs, apply safety restraints, reinforce reality if the patient starts to hallucinate, reduce stimulation, apply safety precautions. What are you going to do? Someone tell me in the live, detox. Is it detoxification or detoxification? Which one is it? Thank you. Detoxification. All right. I know you hate select all that applies. That's why I'm giving you so many. You guys got to get used to them. Remember, select all that applies. You treat them as true or false. All right. So yes, take the patient's vital signs because again, we're going to be, your heart rate's supposed to be 60 to 100. Patients who are withdrawing, we're concerned about them going through tachycardia, that heart rate going higher than 100. We're going to monitor their INOs because remember, fluid electrolytes are important. Fluid balance is important. Next, apply safety restraints. No, there's no need. There's nothing in this question that would warrant safety restraints. There's nothing here that's saying the patient's being a danger to themselves or anyone else. So no. Next, reinforce reality if the patient starts to hallucinate. Absolutely, because hallucination is very likely to happen. That very well is a possibility because remember what's happening. This matter of fact, let me tell you something. That patient is going through withdrawal. Remember, there's hyper stimulation of the CNS. Okay, those neurotransmitters are going like this, right? This patient may even experience psychosis. So absolutely, you're going to want to reinforce reality. That is true. Reduce stimulation. That is true. Apply safety precautions. Absolutely. What do I mean by apply safety precautions? Seizure precautions, because we know that patient's at risk for seizures. We want to make sure that the patient doesn't have any falls, that the patient does not injure themselves or is not injured. Your patient's admitted for alcohol dependency. Which patient belongings should be placed in a locked area? Would it be their toothpaste? Would it be their toothbrush? Would it be their shaving cream? Or would it be their mouthwash? Your patient's admitted for alcohol dependency. Which of their items are you going to lock away? Very good. Mouthwash. Why? Mouthwash contains what? Alcohol. And so if they have alcohol dependency and we're trying to treat them for that, we want them to stay away from alcohol. Very good. Your patient is experiencing alcohol withdrawal. They're diaphoretic, blood pressure is high at 200 over 99, heart rate's 102. What medication would you expect to give this patient? Would it be Haldol? Would it be lorazepam? Would it be benztropine? Or would it be lanoxone? Very good. Guys, this is a famous, I'm not going to say famous question because this is not how it's worded on NCLEX, but I will say a famous concept that has been seen on NCLEX since I don't know when, but forever and a day. It's been over 10 years. This thing's still been on NCLEX, even on this new version. Okay. You need to know this. When it comes to alcohol withdrawal, you expect to give the patient a benzodiazepine, such as lorazepam, because it does what? Bring everything down. Because what's happening, what we're concerned about, again, is that hyperstimulation of the CNS. Now let's look at the wrong answer choices. Haloperidol, Haldol, that's an antipsychotic. Benztropine, that is a medication used to treat the extrapyramidal symptoms that happens when a patient takes antipsychotics such as Haldol. And then naloxone, that is a medication that's given to reverse the effects of like CNS depression when a patient has an opioid overdose. But when we're talking about alcohol withdrawal and those clinical manifestations, you expect a benzo to be given such as lorazepam. Your patient was drinking heavily and can't recall events of what happened during the inebriation. What is this known as? Is it known as a blackout, hangover, tolerance, or delirium tremens? Very good. Blackout. They can't remember what happened during that time. Now, hangover is that horrible feeling you have the next day, right? The nausea, the vomiting, the headache. You just want to throw yourself in a lake somewhere. Tolerance. Tolerance is needing more of a substance to get that same initial high that the person used to get when they only had a little bit. And delirium tremens. Delirium tremens, that is the worst type of alcohol withdrawal, where the patient, their whole body can go into tremor, can start shaking. Patient will experience severe hypertension, severe tachycardia, severe tachypnea. The patient can even go into seizures. It can even go into a coma. Last question. Which food should be eliminated in the diet of a patient experiencing alcohol withdrawal? Would it be milk, coffee, orange juice, or apple juice? I should say which drink because these are drinks. So, which drink should be eliminated in the diet of a patient experiencing alcohol withdrawal? Good. Most of you guys got it correct. Coffee. Remember, patients going through withdrawal, CNS is increased. Guess what? Coffee is a stimulant. So do you think that would be a good idea to give the person coffee? Absolutely not. So we would avoid that. You guys did such a great job. Let's see how you did.